TheraFlu is a combined drug, the action of which is due to its constituent components. It has an antipyretic, analgesic, vasoconstrictive effect, eliminates the symptoms of the cold, narrows blood vessels, and eliminates swelling of the mucous membrane of the nasal cavity and nasopharynx. Compound: paracetamol, phenylramine maleate, phenylphene hydrochloride, ascorbic acid. Paracetamol has an analgesic and antipyretic effect by suppressing the synthesis of prostaglandins in the central nervous system. Does not affect platelet function and hemostasis. Phenylramine is an anti-allergic agent, a blocker of histamine H1 receptors. Eliminates allergic symptoms, has a moderate sedative effect, and also inhibits antimuscarinic activity. Phenylphene is an alpha agonist that causes vasoconstriction, eliminates swelling and hyperemia of the nasal mucosa. Indications: symptomatic treatment of infectious and inflammatory diseases. RIVI, including influenza, accompanied by high fever, chills, body aches, headache, and muscle pain, runny nose, nasal congestion, sneezing. How to use: inside. The contents of one sachet are dissolved in 1 cup of hot but not boiling water, taken hot. A second dose can be taken every 4 to 6 hours, no more than 3 to 4 doses in 24 hours. TheraFlu for flu and colds can be used at any time of the day, but the best effect is when taking the drug before bedtime at night. If there is no relief of symptoms within 3 days after starting the drug, you should consult a doctor. Don't use TheraFlu for more than 5 days. In patients with impaired liver function or Gilbert syndrome, it is necessary to reduce the dose or increase the interval between doses. In severe renal failure, creatinine clearance less than 10 ml per minute, the interval between doses should be at least 8 hours. In elderly patients, dose adjustment is not required. Contraindications: hypersensitivity to the components of the drug, severe cardiovascular diseases, arterial hypertension, portal hypertension, diabetes, hypothyroidism, angioclosure glaucoma, pheochromocytoma, alcoholism, saccharosyl simultase deficiency, fructose intolerance, glucose-galactose malabsorption, simultaneous or within the previous 2 weeks taking monoamine oxidase inhibitors, simultaneous use of tricyclic antidepressants, beta blockers, other sympathomimetics, pregnancy, the period of breastfeeding, children aged up to 12 years. Special instructions: in order to avoid toxic damage to the liver, the drug should not be combined with the use of alcoholic beverages. Patients should see a doctor if observed bronchial asthma, emphysema, or chronic bronchitis. Symptoms do not improve within 5 days or are accompanied by severe fever lasting for 3 days, rash or persistent headache. This may be sign for a more serious disorder. TheraFlu may cause drowsiness, therefore it is not recommended to drive vehicles or engage in other activities requiring concentration during treatment. Side effects: from the hematopoietic system, very rarely thrombocytopenia, agranulocytosis, leukopenia, pancytopenia. Allergic reactions, rarely, hypersensitivity, rash, shortness of breath, anaphylactic shock, urticaria, angioedema, frequency unknown, anaphylactic reactions, Stevens-Johnson syndrome, toxic epidermal necrosis. From the nervous system, often, drowsiness, rarely, dizziness, headache. Mental disorders, rarely, irritability, sleep disturbance. On the part of the organ of vision, rarely, mydriasis, persistent of accommodation, increased intraocular pressure. From the side of the cardiovascular system, rarely, tachycardia, palpitations, arterial hypertension. From the digestive system, often, nausea, vomiting, rarely, constipation, dryness of the oral mucosa, abdominal pain, diarrhea. From the side of the liver and biliary tract, rarely, increased activity of hepatic transaminases. From the skin and subcutaneous tissues, rarely, skin rash, itching, erythema. From the urinary system, rarely, difficulty urinating. General reactions, rarely, malaise. If any of the above side effects worsen or any other side effects appear, the patient should consult a doctor.